there have been several studies looking at the effect of aspirin in both the primary prevention or the prevention of a first heart attack or stroke, as well as in patients who are on multiple antiplatelet or antithrombotic therapies. Can we start peeling off medicines? And I think there are two very, very separate areas, but both very, very interesting data and compelling. So regarding the prevention of a first heart attack or stroke, there have been a lot of trials published in the last few years that really have demonstrated that aspirin really needs to be counterbalanced by its benefit versus risk, such that while aspirin probably prevents a first heart attack or stroke by a marginal benefit, there is a significant increased risk of major bleeding. And I think it just reminds us of why we are all physicians and why it is the art of medicine, and it's not black or white. It's not that every patient should be on a drug, be it aspirin in this example, because while it does prevent a first heart attack or stroke in certain individuals, it really does need to be balanced against its risk. I think there was an interesting trial that showed that perhaps in the elderly, there really is no benefit of aspirin for the prevention of a first heart attack or stroke. And I think it's probably because elderly patients are at higher risk of bleeding. And I think it really does call into question the whole use of aspirin in this topic. Regarding peeling off medicines, right? So there have been a lot of trials in the last year that really have looked at when you're treating patients for a heart attack or an acute coronary syndrome and they're on multiple antiplatelet and antithrombotic therapies. So they're on very, very strong therapies. And the question now is, can we start peeling off medicine? So there have been a few studies that have looked at what about if you remove aspirin? And the data to date, I think, is compelling that that's a potential option in a lot of patients. I think that it's not definitive yet. I think there is less bleeding, and I think there's not a significant increased risk of having a cardiovascular event, but I think numerically there are more events, and I think we really have to sort of see more data, larger trials before we start taking off drugs such as aspirin.